Good evening, ladies and gentlemen. Once again, I remain my humble self, Lucky, Dr. Drugs, and it's a pleasure to be presenting sudden death and hypertension as a case study. Remember that as we go on, in case we have questions, we are free to write them down. So after the seminar, we can ask our questions and more to come. So this is the flyer that a lot of us have got. And I remember my humble self once again, Lucky Dr. Drugs. And our table of content is very simple and straightforward. Now, we can't talk about sudden death and hypertension without talking about lifestyle diseases, because many lifestyle diseases lead to sudden death. Then hypertension management and reversal, we're going to single that out. Then how does hypertension cause sudden death? We'll talk about diabetes briefly and obesity, detox and weight management briefly as well. We'll know why shortly. So I keep asking this question: what are the greatest assassins? You see, two things that kill humans the most are cholesterol and stress. Unlike what people normally expect an assassin to be, someone or something that is dressed like this and locks in the night and all that. But unknown to a lot of us, cholesterol and stress are actually the greatest assassins. I talk about this a lot. Of course, cholesterol does this by blocking blood flow oftentimes, and also other issues as well, and depositing in places where it's not supposed to be, leading to what is called an ischemia. Take note that an ischemia simply means blockage of blood vessels. Then stress as well leads to production of reactive oxidative species that damage DNA directly. Now, if you look around you today, you see there's a lot of tension and stress. Hence, you can see why it's possible that we're having a lot of cases, especially sudden death. So lifestyle diseases are linked to one's lifestyle and are non-communicable diseases. And examples of such lifestyle include lack of physical activity. Some people are couch potatoes. They don't go anywhere. Just sit down watching TV from morning. Now, Big Brother Nigeria started. Now, some people may not even stand up from their house till for the next how many days. And then we have poor dieting. Of course, we know that unwholesome diet can stress the system. We have alcoholism. We know that directly leads to the position of free radicals and bad cholesterol in the system. Smoking is just another way of injecting free radicals and reactive oxidative species that damage DNA directly. Substance abuse, lack of rest, and other lifestyle choices that are unwholesome. So lifestyle diseases include these: cardiovascular diseases. We're going to talk about that because hypertension is amongst it. Atherosclerosis simply means blockage as a result of cholesterol aggregates or deposits. Obesity, type 2 diabetes, stroke, respiratory ailments, fatty liver disease, high blood cholesterol, and heart attack, and so on and so forth, are all lifestyle diseases, which are often reversible and treatable. But funnily, their treatments are not the way we think. A lot of us use chemical drugs and waste our time, whereas lifestyle diseases, the treatment is in the name, lifestyle. Talk about that shortly. Now, prevention of these lifestyle diseases entail avoiding avoidable risk factors, and lifestyle diseases are mostly reversible. But guess what? Prevention is better than early detection. These are just a few of cardiovascular diseases. Just to mention a few: coronary artery disease, hypertension, stroke, angina pectoris, and one I always like talking about, which is cardiomyopathy, that is change in the shape or structure of the heart, where people have what is called ECG as echocardiogram to determine whether the heart has lost its shape as a result of probably a lot of stress due to pumping hard in hypertension and all that. But there's one of them that is very unique and peculiar, especially to our lovely ladies, which is Takotsubo syndrome, which is sudden enlargement of the heart due to emotional stress or physical stress. That is why you see that when women have a heartbreak, they don't hold their head, they hold where? Their heart. And we have to take care with our ladies, because this is often peculiar with them. Men, please stop breaking our ladies' hearts. Then cardiac arrhythmias, congestive heart failure, carditis, and all that, and lots more. The human heart is just about a fist, size of the fist, and located somewhat to the left. The apex is somewhere between the fifth and sixth mid-clavicular line, intercostal space, mid-clavicular line, yes. And what that means is located somewhere around here. That's where the tip, that's the apex, that's this part here. And you can see it's somehow tilted more to the left, and its function is basically to transport food or nutrients and oxygen to the cells and remove or take away waste products like carbon dioxide and waste materials from the cells, back to the lungs and other places that they are taken out of our bodies. This is what cholesterol blockage looks like. Okay, this is a blood vessel. You can see that the blood here has gotten to this point. What cholesterol has already done its damage and its crew, and they're blocked there. And you can see what Yoruba will say, dark bada. They've gone back again. The blood is going back. That means all the cells on this part here are dying or dead. That is why people have a lot of symptoms. So you can imagine if this blood vessel is located somewhere very critical in the heart, you see the heart can back up and lead to sudden death. Talk about that shortly. In our former video, we've had videos on YouTube. Go to Dr. Drugs on YouTube and other social media, and you see a lot of videos that have been done on hypertension, reversal, treatment, diabetes reversal, and all that, cholesterol and all that. They're all there. This is myocardial infarction, which is simply heart cell death due to blockage of blood supply. Then we have sudden cardiac death. That's something we're talking about today. But in another, we just coined it another way. Angina pectoris is just the symptom that is felt when the cells in the heart are dying as a result of blockage by cholesterol, which hinders blood supply to them. So they begin to die because of lack of nutrients and oxygen, and they send a signal as they cry out in pain to the medially to the chest here, neck, shoulder, the jawline, and all that, especially to the left part of the arm here. That signal is called angina pectoris. That means the heart is actually sending a signal. It's more like nature's alarm or God's alarm to tell us that there's problem somewhere around that area. And these are the symptoms. The symptoms of coronary artery disease are not too far from what I'm talking about today, because you see that the name is actually sudden death, but oftentimes it's not that sudden. The human body is designed in such a way that it gives a lot of signs. In fact, if the human body were like a road, you will see that the driver will be saying, no road, go back, construction ahead, and the driver keeps moving because people are trying to achieve all sorts of things every day, but forgetting that without your health or body, you are wasting your time. Now, or one is wasting his or her time. Now, coronary artery diseases are more prominent in men than women, and often appear in men up to 10 years before women. Reason why is because women have estrogen, which is nature's female biological protector, because it is vasoprotective, osteoprotective, and all that. And that is why you see that when women begin to approach menopause, you find that they begin to have signs and symptoms that are related to problems associated with what estrogen used to protect, because estrogen level begins to what? Drop. Go to YouTube, yes, you will see a video I put there on menopause and early menopause and all that, and you can see how the complications and comorbidities can be managed. Then just type Dr. Drugs on YouTube and you see that. Then you see shortness of breath, extreme tiredness or fatigue, insomnia, anxiety, and a lot of other things we'll be talking about shortly. Symptoms of coronary disease. These are the risk factors, quite similar to what we're talking about today, from hypertension, diabetes, lack of exercise, obesity. I want us to understand that, you see, lifestyle diseases move like a gang. They move together, and one can lead to another, and one can stem out from another. In fact, if someone is having fatty liver disease, oftentimes you check their cholesterol level and you find that the lipid profile is bad, because in the first place, the liver is responsible for metabolism of cholesterol, and people don't know. That is why during weight management is important. The liver is adequately detoxified, so it will have enough space or room to what? Metabolize cholesterol and other fatty substances that make people obese. That is why you see a lot of people that have obesity often have fatty liver disease and high blood cholesterol. And guess what? They often have type 2 diabetes. And once you have type 2 diabetes, hypertension is on the way. And once somebody has hypertension, another lifestyle disease called heart attack is on the way. And once somebody is having hypertension and is already approaching heart attack, please bear in mind that one of their leaders, which is called a stroke, is also on the way. So these lifestyle diseases move together. So tackling them, even tackling one of them, can help you to eliminate or eradicate the others. Now, we also have other risk factors like smoking, alcoholism, and more. This is cardiopulmonary resuscitation, CPR, which is essential to help people that are having cardiac issues to recuperate. It is not designed for us to find girlfriends or boyfriends or use style and kiss people that are drowning inside the water or in swimming pool. Because I know some guys who just begin to gather around swimming pool when they find girls about to pretend she's trying to swim, and they're hoping that she will have problems they can give mouth to mouth. Mouth to mouth is for what? Life-giving breath. And this is how it's done. Chest compressions of about 5 to 6 centimeters deep, about 100 to 120 times per minute. It's serious business, and about 8 breaths of life through the nose or mouth. Of course, when it's a fine girl, our bobos will definitely go for the mouth. But please be serious about it whenever it happens. Now, sudden death. Beautiful. So it's also known as sudden cardiac death. It's a sudden and unexpected death that occurs a short while after the onset of symptoms. And the symptoms are not too far from those we're talking about. We're talking about cardiovascular diseases. And it's often caused by a heart condition or other underlying medical issue that disrupts the heart's normal functioning, leading to a fatal arrhythmia, that's abnormal heartbeats, heart failure, cardiac arrest, etc. Now, sudden death can occur with little or no warning signs, and it is often unpredictable. However, some common causes and risk factors include heart conditions, hypertension, coronary artery disease, cardiomyopathy. That's the one that where the people go for the ECG, that's echocardiogram, to check whether the heart shape and structure has changed due to most likely hypertensive heart disease, heart failure, and arrhythmias. You can see electrical heart disorders. That means they affect the heart nerve conduction. Remember that what makes your heart beat with this particular rhythm is that there are nerve cells that are designed or that are sending these electrical impulses that radiate around the heart to trigger the heart muscles to contract rhythmically in a particular rhythm to help make sure that the blood supply to the body and from the body is done efficiently. Now, if anything happens to these nerves, what do you think will happen? It will just be like a DJ that went to that left his post. You see that the dance floor will be empty because the beat will begin to become abnormal, and it will begin to people begin to leave. And that's exactly what happens when there's a damage to these nerve cells. We have the SA node, what we call the pacemaker cells, the atrioventricular node, bundle of His, Purkinje fibers, and all that. In fact, if the SA node has a problem, we have what is called a wandering SA node. Then the DJs begin to shuttle themselves between the upper and lower, and you see the heart begins to beat abnormally, and before you know it, the person is having sudden death. These are signs we should look out for. Now, other medical conditions like severe asthma can lead to that, because you know that severe asthma, something like status asthmaticus, could lead to lack of oxygen going to the heart. You can see we have high blood cholesterol. Of course, we talked about that earlier. Remember that cholesterol and stress are the major assassins. Then fatty liver disease, as aforementioned, which is a risk factor for high blood cholesterol, and is also and high blood cholesterol is also a risk factor for fatty liver disease. And then you have external factors like trauma. You can imagine somebody receiving a punch to the chest at a very wrong time. You can hit the chest so hard that a piece of cholesterol blockage can break off and travel to another part of the heart, block it, and the person has gone to meet his maker. Then there's problem. And of course, electrocution. We all know that in some states in America, yes, I think they have this as a form of death sentence. You see that the prisoner or the condemned criminal is strapped to an electric chair and electrocuted, and the heart does what? Packs up. That is short. That is death by sudden death in short. Of course, drug overdose. You see one or two popular, like a popular actress we heard about, Whitney Houston, and a lot of other people that died as a result of this. May their souls rest in peace. And you see, if you look at this picture here, you can see that this person fell face flat, and his spirit is the angel is even surprised that he died so fast. But that is how sudden death can be. So let's all be cautious about these things. The moment you see, as you can look at this, if you look at this animation here, you can see that an angel is already receiving somebody again as a result of sudden death. And the symptoms should not be overlooked. Chest pain or discomfort, shortness of breath, dizziness or lightheadedness, confusion or loss of consciousness, abnormal heartbeat or palpitation, and so on and so forth. These are symptoms that should not be overlooked. So let's talk about hypertension briefly because we have this on YouTube. Just go to Dr. Drugs, click on YouTube and enjoy yourself. So of course, it's a sustained elevated blood pressure above normal. This is the normal BP range, which is 100 to 130 over 60 to 90. But it's better you maintain 80 anyway, to be sure that you are as much as possible. Then blood pressure is equal to cardiac output times peripheral resistance. Everything about hypertension is here. From what causes it to the drugs that are used to manage it, mechanism of action and all that are all here. So there's no need for us to, if you understand this formula can save thousands of lives. Because if you know about this, you know about a lot of drugs, you see that a lot of things like you have the propranolol, you have the atenolol, and all the law affects the cardiac output. So of course, especially the one that pregnant women take, Aldomet, which is alpha-beta-dopa, which acts via negative feedback mechanism on alpha receptors. You can see that also affects cardiac output. Well, then we have peripheral resistance. That we're talking about the lisinopril, talking about the telmisartan, talking about the amlodipine, ifedipine, all those ones that work on calcium channels that help the blood vessels to expand, all those ones that work on angiotensin converting enzymes, of course, and those ones that block angiotensin receptors. These things all work all around this formula. That's why it's important we go and study it. Just go and watch the video on YouTube and you understand better. So this is cardiac output, which is the amount of blood pumped by the heart per minute. You have peripheral resistance, the resistance that must be overcome to push blood through blood vessels to enable blood flow through the system. Now, imagine that you are sucking something through your straw, and then I give you something like apple juice. It's easy, just goes smoothly. But if I give you something like, let me say, pap, that's what we call pap here. You see that it's thick, and you see you need more pressure to pull. That is the origin of high blood pressure for a lot of people. And today, you're going to be opportune, even though I'm going to be very fast. You will tell me finally whether hypertension is reversible or not, because I know a lot of us go to hospital and they say hypertension is for life. Take this, but bear in mind that nobody will make a medication and expect people and begin to advertise things that will make people not to buy it. Now, this is exactly what I'm talking about. You can see this blood vessel is very smooth, all things smooth. This is what we call smooth sail of blood in the blood vessels. That the heart will need less pressure, or will need less pressure to pump. But you can see when you look here, the shawarma, the pizza, the spaghetti, the indomie, the bread, and everything, the meat pie and pastries and all that have come here to contribute to cholesterol blockage. You can see that it's more difficult for the blood to flow, and the heart will begin to pump with a higher pressure. That is the origin of hypertension in about 95% of cases. So if you tell me what will happen when this thing is removed, that is why you will find out whether hypertension is treatable. We'll find out shortly. These are the types. As you can see, this woman has sentenced her unborn child to high blood pressure by smoking while the child is busy relaxing in her womb. Of course, when mothers don't breastfeed their children adequately, there's also a link with hypertension. And we all know that it is said that hypertension, or primary hypertension and essential hypertension, is of unknown causes. But we found out recently, scientists have found out recently, that it's strongly linked to peripheral resistance. Secondary hypertension is as a result of a known cause. When you withdraw it, you find out that the person's BP goes down. Of course, if someone is told that his money is missing in the bank, his BP can go up, what I'll call financial hypertension. But when the bank manager calls back and says, brother, your money has been found, the BP goes back down. That's a cause called secondary hypertension. We have pregnancy hypertension, which reverses normally after parturition or delivery. And then we have these hypertensive crises. Had a young lady that's a very good friend of mine that fell victim to something like this, and she shockingly had a partial stroke at a very young age. But God so kind, it was intervention. She's doing very well now. So you can see the hypertensive crisis is terrible. We have others as well. Now it's a silent killer. You can never know via eye gauge. I always suggest that anyone that wants to assume that him or herself is having a normal blood pressure, to remember that some people sleep and don't wake up. That is because hypertension has stolen them in the night. It's not their uncle in the village struggling for land with them, but it's just hypertension. That is why it's called the silent killer. And we'll see how hypertension can lead to sudden death very soon. Of course, if it has pity on people, it gives headache at the back of the head, especially in the morning, lightheadedness, altered vision, fainting episodes, and all that. Please and please, this is the only way you can measure your blood pressure. There's no other way. Eye gauge does not help. I know myself, I can feel it. You can never feel your blood pressure and know what it is. You can buy a simple gadget like this. So I always keep this on my desk. Anytime, anywhere I go to have patients, it's so easy. Just look at how easy. They're very simple. Very simple. And it's something like this that uses, what's it called? Phone charger. You don't have a problem. Just plug in your phone. You can measure the BP of everybody in your village and it will still be there. So why don't you just get something simple like that? So it's accessible and one can measure BP, especially when you're having headache or you're having dizziness or you feel you're overstressed. Know your blood pressure and know when you need to rest. Since that causes and risk factors, look at these cards. You already know what it is all about. Obesity, smoking, highness, alcoholism, poor dieting, and all that. This is how it is reversed. Because I mentioned that it's a lifestyle disease, so lifestyle modification, very, very important. You have to monitor BP regularly, avoid excess salt intake, exercise, weight management, and so on and so forth. But Mediterranean diet is something that I always love showing people, and I don't. And it's often very interesting because it's named after a group of humans called the Mediterraneans. Quit smoking, reduce alcohol intake, and rest. So of course, use of appropriate medication. But these basically work by reducing cardiac output, the rate the heart pumps out blood, and peripheral resistance, as aforementioned. They're designed to take one out of danger. That's what it is. So people that are consuming antihypertensive as if they're eating hobnobs or chin-chin, please be careful because the side effects are never announced as much as the advertisement for people to buy them. So one should be wise, apply wisdom, follow your health practitioner's instruction. But when you should know when something is not having headway, you have the right to talk to your practitioner and say, this is not working. It's like somebody of 32 years taking 4 different classes of antihypertensive and it's still not working. BP is still 211 over something. And your practitioner is still adding more on top. Where are you adding to? So you're reaching the point where the patient will now be taking a cup of tablets. Then when they say it's not working, you say, it died after a brief illness, God forbid. You have to use common sense and know that, look, nobody is going to tell you the truth when it's going to most likely be against them. So use your brain and know what to do. Knowing that it's a lifestyle disease, we should see. I'll show us something shortly, and let's find out whether hypertension is treatable or not. It's right there in your phone, but many of us don't know. Of course, the use of natural pharmaceuticals in management and reversal of hypertension is also indicated. This is a wonderful picture. All things bright and beautiful. No Azu, no Hennessy, no Moët, no Benson, St. Maurice, no local gin, Kai Kai or Gogoro, no, nothing. Just all things bright and beautiful. This is how people eat so they don't have hypertension. So this is part of what is called a dietary approach. We'll talk about that shortly. This is how hypertension is so silent that about 80 million Nigerians are living with hypertension. But guess what? Out of that 80 million, 26.7 million are receiving treatment. So please tell me what happens to the remaining 53.3? Those are the people that will say that it was an arrow was sent to them. They don't know that they have hypertension. They are virtually walking dead. That is just the truth. These are the complications. Number 1, sudden death. Eye problems because of the blood pressure can rupture blood vessels in the eyes. Yes, you can see stroke, heart problems like heart failure and all that. So hypertension as a major cause of sudden death. So imagine this picture you're seeing here is already showing that at every given point in time, even when someone is just born, if there's death can always hover around with poor lifestyle choices. That's what this picture is just saying. So heart attack is one of the things that can that can lead to sudden death because heart attack can be caused by high blood pressure. How does it happen? High blood pressure damages the coronary arteries, the ones that supply the heart, causing them to narrow and harden. Remember, atherosclerosis, ischemia, as I mentioned, which means blockade. Next, a blood clot from nowhere just appears. just like a woman in an Indian film that nothing concerned came out and started shouting Nehi, appears there and blocks the already narrowed artery, cutting off blood flow to the heart muscle. What do you think will happen? The heart begins to pack up because oxygen and nutrients are already denied to cells. And hence, the symptom, as I mentioned, angina pectoris, that's the pain that happens medially in the chest and radiates to the left arm, through the jaw and all that. And you can see that the nature's alarm to say there's a problem, just like somebody that was in his house and a thief jumped over the fence into the house and the alarm system begins to shout. And that is how angina pectoris shouts to warn people. But of course, the average victim continue to open his shop, close his shop, count his money, go to bank. Even though he's saying doing like this in the bank, he doesn't mind. As far as the money, he's checking the eye on the money, forgetting that something is going on inside. And then they say that the uncle in the village wanted to collect his land and shot an arrow, or he stepped on something. It's always something. There's no name. Nobody knows what it is. There's always scientific explanation. So please, let's pay attention and see how we can avoid this problem. Now, it can cause cardiac arrest and lead to what? Sudden death. Stroke. High blood pressure automatically can rupture a blood vessel, of course, and also because it damages the lining in the blood vessels, and cholesterol from nowhere appears once again like an Indian woman that's nothing concerning the movie, and she just jumps out shouting Nehi, Nehi, and starts singing and blocks the place, and there's a problem, and that can lead to what is called ischemic stroke. But ultimately, the problem is that the part of the brain dies. That can lead to what? Sudden death as well. Of course, cardiac arrest is self-explanatory because we know that when the heart has lost its capability or capacity to perform its function, then the person is arrested by his own heart, aka cardiac arrest. That's just a layman's explanation of what this is, and that can lead to sudden death. So but high blood pressure disrupts the heart's normal rhythm, causing the heart to beat too fast or too slow. Remember that even the blood vessels that supply the nerve cells can be blocked, and hence the DJ in quotes or the SA node or pacemaker cells can lose beats and begin to cause problems, and the person can have what is called atrial fibrillation or palpitation and other cardiac arrhythmias that can make the heart just give up the ghost before the person gives up the ghost on that sudden death. An aneurysm is just like a balloon. If you've gone to remember when we go to a party, you can see that the balloon, you pump something and it begins to bulge. And that is how you apply pressure into the balloon. That is how high blood pressure applies pressure in the blood vessels, and the blood vessels begin to balloon. Unfortunately, this happens in the brain, in the aorta. That person is most likely discussing with his maker because the person most likely would have kicked the bucket. That's a problem. Now, heart failure. All these things will lead to what? Heart failure. We all know what failure means. So we know that when the heart has failed, which is the most important organ in the body, because death is certified when the heart stops beating. If the brain is dead and the heart is still beating, that person is still alive. That is it. So it's only when the heart stops beating that one can be certified as dead. But heart failure, which often as a result of prolonged hypertension, forces the heart to work too hard, leading to thickening of the heart muscles, as hypertrophy or enlargement of the heart. These two are just basically what they call cardiomyopathy. If you translate this from Latin, it just means heart muscle problem. That is what it just means in Latin. So you can see, or heart muscle damage. So the heart may also become unable to pump enough blood to meet the body's needs. Then one begins to have fluid buildup in the lungs. That's why you hear that some people, I heard of a young lady recently that died as a result of fluid in the lungs. It's what we call pulmonary hypertension. What that means is that if the heart is not able to even receive the blood efficiently after it has received oxygen, then the blood begins to accumulate in the lungs with high pressure. And guess what? Blood components begin to seep out from the blood vessels into the lungs, and then all forms of issues begin to happen. Pleuritis, another name I don't want to bore us with, begin to take place. Of course, the liver can also be in danger. Then the feet also sometimes begin to swell up because the heart has successfully pumped blood downstairs. Or you pump the blood back upstairs to the heart again, it's a problem. And then the blood begins to pool at the feet. That's why you find out that people that have heart problems or congestive heart failure, for instance, you find out that they have fluid at their feet. And when they lie down on the bed and put their legs up or put their legs on top of a pillow, you see that the leg begins to go back to normal size. That is what is called pedal edema. Now, all these things I've mentioned can lead towards sudden death. So, how do we reverse hypertension? This is how to reverse hypertension. And hypertension is treatable. Tell your cardiologist, you can give them my number. If they say that it's not treatable, let them teach me how it's not treatable. I can learn. But I know as a scientist and a health practitioner, when you hear that, you hear a hospital trained pharmacist, I'm a doctor, I'm a pharmacist, I know both sides to good extent. So I know that hypertension is treatable. So don't be deceived. I have handled patients that have hypertension and it was treatable, especially with lifestyle diseases, with lifestyle modification and all that. Because any hypertension that has a reason why it's happening, once you remove that reason, what happens? The person goes back to normal. Now, all lifestyle diseases are mostly reversible, including hypertension. And evidence is the presence of what? Dietary approach to what? Stop hypertension. I will show us something that will shock some of us just now. That means it is stoppable. Why are many antihypertensive medication vasodilatory? That's one question we should ask ourselves. Because they're trying to what? Improve blood flow by expanding the diameter of the blood vessels. Now, ways this can be achieved include dieting, weight management, detoxification, exercise, professional fasting, as well as handling other disease conditions that lead to hypertension, like type 2 diabetes, and all that. And you can see that there's something beautiful. You see, just go to your phone, type DAS and hypertension, and read for yourself. They say DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet is a healthy eating plan designed to help prevent or what? Look at it there. Treat high blood pressure. It did not say manage. That means hypertension is what? This is Google. So it's not as if maybe it's there for everybody to read, but a lot of us don't know. It also may help lower cholesterol linked to heart disease called dose lipoprotein, because you know that cholesterol deposit leads to what? Peripheral resistance and increase in high blood pressure. Remember, I showed you that image where we had cholesterol blocking the blood vessel, and I said when you remove this cholesterol blockage, what happens? The BP will definitely go down. These are things that people that are selling antihypertensives will never advertise ever, because if they do, we buy the products. So apply wisdom. Now, hypertension leads to eye problems and cardiovascular issues, as you can see. Remember, we talked about how it can damage blood vessels, and when this happens in the eyes and all that, can lead to problems. So these are examples. I want to show some examples of things that we can use. I'm not saying that you must use these things, but this is what I use for my patients, and I get amazing results. Focus on the active ingredients that are found in these things, and guess what? If you can find them any other place, well, good luck. But I'll guarantee you that a company that has been in existence for about half a century and is all over the world, more than about 170 countries, I would prefer to use such a company's product, because I know that they will never compromise standard. So when you go and buy something that is not authentic for a life-threatening condition, then it's as simple as what? Playing with life. So this is Arctic Sea, because it contains what is called eicosapentaenoic acid and docosahexaenoic acid. And this is their mechanism of action. You can see that they're anti-inflammatory and they what? Prevent cholesterol aggregation. Garlic thyme, on the other hand, contains lecithin, which emulsifies fat and cholesterol. We know what that does. All these are on the internet. Just go to Dr. Drugs and you see, just type hypertension and Dr. Drugs, you see all these things there. Aloe vera gel has been in existence for thousands of years, and its use is numerous. We have cardio health, which contains coenzyme Q10. We all know that it's very important. Lungs, liver, kidneys, and where? Heart tissue. It's also an analog of what is called ubiquinone. Bear in mind that the word ubiquinone is stemmed from where? Ubiquitous, found everywhere in the body. So that tells you why it's very important, because it helps to stimulate what's called mitochondrial, also stimulates mitochondrial activity. You understand? Helps to promote mitochondrial activity, and see that the mitochondria is just like the generator of the cells in the body. Apart from that, it's also very awesome for children that have autism, that's intellectual disabilities. Autism which is defined as a neurodevelopmental disorder that affects communication, social interaction, and behavior. And you can see this will improve learning. But that's just on the side. Now, Ag Plus contains what is called L-arginine. Apart from the fact that people that have hypertension may have stroke and their muscles begin to shrivel, L-arginine is an amino acid that can help to build what? Muscle mass and all that, and help against things like things like weakness, muscle weakness, that's also associated with people that have been in bed for too long. But bear in mind that it also leads to the production of nitric oxide, which is a potent vasodilator. In fact, nitric oxide is one of the major ways that some people, this Viagra and all these people take, is also part of the ways it helps to, help with the, entanglement facility, as you can see. When you make the blood vessels expand, you see that these blood vessels that have expanded can actually allow blood flow better. And guess what? Blood flow, you're talking about the downstream sector and also talking about the upstream sector. Men, you know what I mean by downstream sector. And then you can see that, and this is also why a lot of men don't joke with this, because amlodipine is an entanglement facility killer. Just know that one. I'm not saying it. Go and Google it. In fact, there are many of these antihypertensives. The first thing they tackle, they destroy is the entanglement facility. So one of these days we'll talk about the entanglement facility and how it can be improved and all that. Talk about how cholesterol affects it. So that's that. Oh, briefly, diabetes, we all know that that's an interplay between blood sugar and insulin. And of course, it's a sustained elevation of blood sugar above normal range. This is how insulin enters. This is how insulin allows glucose enter the cells. In its absence, it doesn't. And then we can always watch this on Dr. Drugs. Just type Dr. Drugs and diabetes management and reversal or treatment, and you see there. So this is the definition of diabetes. So just running through type 1, which is juvenile onset. This as a result of lack of insulin. This has no cure so far because one must have to take insulin injection. Then we have type 2, which is also known as insulin resistance. Now, this is very unique because it's most common and happens about 90-95% of cases, but often gives signs people don't notice. Hot belly, fat accumulation on the shoulder, fat in the cheeks, and all that. And you see that the person begins to crave more and more sugar, more and more carbohydrate and all that. These are signs that the person is having what is called insulin resistance. Oftentimes, diabetes starts with overweight. That's right. Of course, pregnancy or gestational diabetes reverses after childbirth. This is pancreatitis. When the pancreas is sick, it can lead to diabetes. In fact, bacterial infection of the pancreas can lead to diabetes. Some people think that when they have diabetes, it means that the pancreas is gone. No, you can give antibiotic, and the bacteria that is making the pancreas to get inflamed disappears, and the person's blood sugar level goes back to normal, and we all shout that what God can do does not exist. These are the signs and symptoms. Looking at this man running to urinate, you know what is happening. If he doesn't get to that toilet in the next 2 seconds, according to that comedian, say 2 seconds everywhere boss. So his bladder can explode and he will urinate on his body. So you can see that. But the maximum this happens is because as the blood is trying to remove sugar, it does that through urine, water goes out, the person gets thirsty, drinks more water, and the cells don't have glucose going in, so it makes them to eat. And that's why the 3 major signs of hypertension is urinating frequency, excess thirst, and excess hunger, which in science we call polyuria, polydipsia, and polyphagia. Of course, we have headaches, itchy skin, cachexia, which is unexplained weight loss that happens later. Most people that have diabetes often have obesity first, then later the sugar in the blood dries them up via process of what is simple process of osmosis, and also other factors that are called cachexia, which is unexplained weight loss as a result of chronic disease condition. Blurry vision, of course, we know that the retina gets damaged by free radicals. Weakness, the glucose is not entering the cells, mood changes and irritability, the body, inputs, depression, and a lot of all that. You can see, okay, this cat is here again. We already know that this cat is most likely diabetic. Then these are the reasons why people have type 1 diabetes, trauma, autoimmune attack, that's the body attacking itself, surgical removal of pancreas, and so on. Then you see these are the type 2 diabetes also. These are the risk factors. Obesity, number 1. Once again, that's being overweight, excessively overweight. Obesity is defined as excessive detrimental accumulation of body fat. It's a function of body fat. To talk about that briefly. Smoking, alcoholism, pregnancy, lack of exercise, lack of vitamin D, stress, and all that. These are the complications, attacks the eyes, the kidney, the nerves, cause leading to those symptoms that people know about. Most specifically, look at them here. Diabetic retinopathy, that's damage to the retina of the eye, diabetic neuropathy, so on and so forth. This is the link between diabetes and hypertension. People are always wondering why they go hand in hand, like Jack and Jill. You can see, diabetes and hypertension often go hand in hand because the cholesterol blockage caused by diabetes leads to what? Increase in peripheral resistance. It deposits in the blood vessels and the heart has to pump with higher pressure to overcome that blockage. And that's how BP goes up. That's our formula down there again. See that? This is the budget for diabetes. This is just as the government reads budgets yearly, diabetes also has its own budget. And that's the budget how it wants to destroy the human body. There, this is how diabetes comes as a visitor to somebody's leg, and finally, person becomes a tenant of his own leg and leads to diabetes. We've heard about one or two celebrities that have their foot cut off and they still died because of diabetic foot, because they could not control how they eat and they could not control their weight. That is the reason. So just know that anybody that is obese and has reckless lifestyle will surely one day have type 2 diabetes. It's just a matter of time. It's either the person dies before it comes or it comes before it dies. That is just the rule. That is the law. It's not, once one is obese, it's a matter of, if the person lives up to 200 years, it can land when the person is 180 years old, but it's already, it must be there. So one has to have good lifestyle choices for the obesity. Looking at this guy's face, you see that this man means business. You can see that the normal range of fasting blood sugar, please and please, is not 80 to 125. That's for people that are selling Coca-Cola. They don't want you to stop drinking Fanta and all these sugary drinks. So that when you check your sugar and you see it's 115, you say, oh, it's still normal. It's not normal. That's pre-diabetes. The standard is 80 to 100, and that's what we should target, which is about 80 to 100 milligrams per DL, which also about 4.4 to 5.5 millimoles per liter, depending on the one you are using. That is the standard. Aim at that. These other ways we catch diabetes when it's trying to hide somewhere. Have the 2 hours postprandial and have epidemiology or statistical occurrence of diabetes in Nigeria. That's it over there. These are the challenges involved in management of diabetes. I'm talking about diabetes because we know that it leads to what? Hypertension. And you can see that late detection is also a problem. Self-medication, Sabi news. That leg is not your enemy that puts juju in your farm and you stepped on something. Tell us the name of that thing. It's diabetic foot. That is what it is. So handle it, and you see that if you check many of those people that have those problems and they're going to native doctor and they say that they want to show their enemies, they are going here, going there, the foot is getting worse, it is high blood sugar that's causing it, and amongst other things that can cause it, but mostly high blood sugar. Then some people deny because they say that their father didn't have it, their mother didn't have it, nobody in their family, even their goats, nobody has it. So why would they have it? And the thing is happening to them, not knowing that it is a lifestyle disease. Of course, lack of competent health practitioners. Many of us are here, but our spirit are abroad. We have poor health information system, lack of adequate health diagnostic infrastructure, poor medication compliance because it is tiring. Taking chemicals like metformin and all these day in, day out, taking the linagliptin, taking the glibenclamide, the glibenclamide, and all those things. By the time the person takes them from January to December, you're taking a bucket of drugs by December. You get tired, and of course, it leads to poor medication compliance. Poor dietary compliance as well, economic issues, all those things cost money. Depression, because somebody that has cut his foot will most likely be depressed, because diabetes makes the health practitioner cut off the foot, and the person can be happy. Suicidal tendency because they begin to feel incomplete and all that. So this is how diabetes affects the eyes and other parts of the body. Well, it's similar to the other ones we discussed. And then diabetic retinopathy, we know that it damages the back of the eye, can lead to retinal bleeding and all that, because it also comes with hypertension that also causes hypertensive retinopathy. It's a terrible disease. Diabetes is a disease of diseases. But then prevention and management of diabetes, you can see what we need to do. Dieting, we have to stop smoking, avoid alcoholism, exercise, weight management. That should have been on top. Discipline, because some people don't have discipline. Sometimes they just say, my sugar is not high. They just leave their lifestyle, but if they just go and start eating all sorts of things, drinking all sorts of things, avoid their medication if they are giving anyone to take them out of danger, those are problems. Of course, we use of natural pharmaceuticals and all that, aka supplements as well. This is how they help to manage diabetes. This has been treated before. We're just running through. These are just a few of them with the active ingredients and how they work. We're not saying that you must buy this, but this is what I've used for my patients, and I got wonderful results. So that's what I'm saying. So I trust a company that is about half a century old. I'm not after people that are just trying to do commercial stuff. I believe that these people, they don't. Forever Living product doesn't reduce their standard for anybody. That's why I keep using them. on and on like that. You can see aloe vera gel there. You can see active pro B, etc., etc. We have calcium and vitamin D. Remember, nature mean and all that. Immune blend because of the immunologic part of diabetes that people forget. Ag plus as a result of the muscle wasting of cachexia and all. You can see eye vision for the eyes, B12 plus for the nerves, because you know what is called diabetic neuropathy. That's the burning sensation that happens under the feet, and sometimes, when people are having a high blood sugar and all. If you have cardio health, of course, you know what that does because of the heart and all. Then we have garlic thyme as well, lecithin because of the cholesterol that comes with diabetes, bad cholesterol that are shared with diabetes. Then we have the bee propolis to prevent diabetic foods and also help to manage it. The cream should also be here because that is also very, very wonderful with regards to stopping diabetic food. Then we have royal jelly because you know that diabetes could affect part of the brain, of course, and also damage a lot of things in the body and helps to also affect the entanglement facility. Diabetes attacks the entanglement facility. That's why people that have it often have zero entanglement factor. And the entanglement arena owner is often unhappy. They will have multi-marker fertilized men and women based on things that are shared with them. Oh my goodness, this is wonderful. Weight loss and detox. Just briefly, excessive detrimental accumulation of body fat. That is what the definition of obesity is. Weight management is the process of achieving or maintaining a healthy weight via certain activities, techniques, and physiological processes. You can see that is a function of, like what's appearing in this picture, the exercise machine and the soda and the burger and all this fast food. Obviously, we can see that this person, whoever has this depiction, is on the winning side, definitely, because exercise is taking precedence over the unwholesome or terrible things. So it's a function of calories that are being stored in the body as fat, and those that are burnt off via exercise and activities. This woman is shocked that she's having obesity, but bear in mind that menopause also comes with obesity, especially abdominal fat. That's one of these definitions. Menopause is such a terrible thing, but it's just a natural phenomenon, but it comes with terrible things. So women should be cautious of menopause and take care of themselves before the tsunami of menopause comes and washes a lot of things away, and they have to be left to pick the pieces all around to move on with their life. Why don't you just solidify your life before menopause comes with a tsunami or hurricane? And then you can see, of course, we talked about Mediterranean diet, exercise, illness, and genetics. These are the things that influence weight gain or weight loss. Oh, wonderful. Here it is again. All things bright and beautiful. BMI is just a fair way for us to know how obese somebody is. And that is why I often ask my patients, I need your weight and your height so I can calculate your BMI. Because a BMI that is above 24.9 is overweight. And once it gets above 29.9, obesity 1 and all that, that is the origin of diabetes for a lot of people. So this is how this graduates. The young lady that gets into university to having a boyfriend, to getting married and giving birth to children, this is just how it moves oftentimes with women. But it's always good we tackle these issues early so that we don't have to solve problems that could have been avoided. It's the importance of weight management. Just know that being overweight can lead to these things that are listed here. And that's why we know that weight management is important. Of course, type 2 diabetes, hormonal imbalance, and so on and so forth. Yes, detoxification is very important, as well as these are what toxins are, and they lodge in the fats of fat cells. Dangers of toxins are here, especially some endogenous toxins or substances that are produced in certain people, like androstenedione can be converted to estrone, which affects the parts of the brain that regulates female reproductive activity. So you can see it can lead to infertility. Drinking enough water is very, very important because the kidneys remove toxins and waste products via fluid. That's self-explanatory. This is a Clean9 program. This is professional weight management. Of course, I've modified it to a 30-days program. It's supposed to be a 9-days program, but I modified it to a 30-days program to lock in the new weight. Of course, the 9-days weight loss and detoxification program for that. You can see these are just a few things that are here that work in those things. And this is thermogenic. It burns off fat and converts it to energy, so double gain Garcinia Plus prevents carbohydrate to be converted to fat. These are 10 reasons why quinine is important. You can see then quinine versus obesity. Of course, considering the three major ways that fat accumulated in the body, which is direct ingestion, or elimination of fat, intracellular production, and all that. You can see how hydroxycitric acid also takes care of a lot of things. Thermogenesis burns it off, and a lot of other things like that. C9 also helps to take care of toxins as well. And you can see this boyfriend and girlfriend or husband and wife are so happy because they have lost weight and they are healthier. Beware of rebound weight. People claim that they can never lose weight, but it's not true. You are what you consume. That is just it. So you have to lock in your new weight because your brain knows your weight. That is how it's done. So at this juncture, yes, I would say you are what you consume. And there's a constant battle between factors that repair and protect our bodies and those that break it down. So we must have to be on the winning side. And also, thank you so much for coming. And God bless. So if we have any questions, we can either type it in the chat room, answered. Yes, and if you have any contributions as well, you can also type in the chat room, because we will be rounding off very soon, because we do not like very long seminars or lectures. When using the above listed supplements, should someone stop taking use of antihypertensive? Beautiful. This is a wonderful question. Please and please do not tamper with your medication without a trained health practitioner beside. It's what you call tapering. Professionals know how to do it, because as you are getting well, less quantity of chemical drugs will elicit higher decrease in blood pressure. So one has to be careful. When you're undergoing these lifestyle modification and using these natural pharmaceuticals, your blood pressure will begin to go down. So be in touch with a trained health practitioner to help you taper down. Do not do it on your own, unless you may find yourself crashing the blood pressure. And you know that hypotension is more dangerous than. Now, if you're having a bundle block, that we're talking about one of the nerves, that's the part of the nerves, because that's the bundle of His. Now, if you're having a bundle block, most likely it could be as a result of damage, probably due to lack of nutrients or oxygen. I think the first thing we need to do is to make sure that the lipid profile is in order. Then you begin to help the heart to recover, so that the cells that are still alive, at least those ones that are still hanging for life, begin to recover. We have coenzyme Q10, we have that can actually help patients. We have Ag Plus contains coenzyme Q10 is cardio health. Yeah, that helps what rejuvenate the heart as well, heart muscles, as well as the lungs, liver, and kidney, and other things it does. Then we have the L-arginine found in the Ag Plus. That will help to improve blood supply to the part of the heart that is affected. That's the part that is involved in what you call action potential or nerve conduction that helps with the rhythm of the heart. There's a problem then. Then, of course, lifestyle changes. You have to check your weight, because obesity, fatty liver disease, and other lifestyle diseases can worsen that situation. Apart from the fact that one must have to make sure that if you are placed on digoxin or digitalis or whatever you are placed on, make sure that you stick to your practitioner's guidance. And when they find out that, okay, you're getting better as you're using the natural pharmaceuticals, they will decide. The trained practitioner will decide what to do, not you. Because this is a very serious matter. Because if one has a pacemaker or something there, and the person begins to do whatever they like, such a person is on their own. Because it is not advisable to tamper with your medication without a trained health practitioner. Bear that in mind. So this is just a few. Of course, weight management programs can help, and a lot of other things. Just link with the person that got you here, and of course, you see that the person will help you. That's a Dr. W.O. Oh, he's a medical doctor. That's great. So that means you understand what I'm saying. So you can see that's important, because we need to make sure that even the nerves that are conducting this action potential that help with the rhythm of the heart have to be healthy. They eat too. They need oxygen. You understand? So that's one thing that can lead to it when you have a problem with the blood supply. And of course, when we take these natural pharmaceuticals and watch our lifestyle, give the heart a fighting opportunity, the opportunity to even heal itself. There's a patient I had, 14 years old. The father is a deacon. Somebody called me during Christmas and told me that this young boy was having hypertension. at the age of 14. And of course, I was so busy during Christmas that this lady appeared and look at it. And I looked at it. This young boy was about to be sent into theater to go, and I don't know what it was. And I told the man, pump and play, that there is nothing surgery can do for this child because of what is called, the child was having what is called stenosis of the aorta, and as also, the child was also having hypertrophic cardiomyopathy. The left ventricle was already thick. I was asking, are you going to scrape out this? So, but when I gave this child, I told the man, I said, look, withdraw these sugary things you are giving this child, add vegetables. They said he doesn't want, he doesn't. I said he must eat it. He has no choice. Even if he doesn't want to eat it, fine. It will help him to reduce the cholesterol in his system. Because the antihypertensive was placed on, but even based on reducing cholesterol, blockage, and all that. And guess what? Within a month, I came back from South Africa and they sent me the results, and this child was already okay. I have it in my phone. If you want, as a hair practitioner, can get across to me. I'll show you these results. You see for yourself, because we can share cases as hair practitioners. So you see for yourself that this child would have gone to the theater and would have been wasted, most likely. Whereas it was just a matter of adjusting the child's lifestyle. And you see, that was, and also give natural pharmaceuticals. So you can see that as an example of just something close to what you're asking for. Now, can a thickened wall of the heart be reversible? Just let me give you an instance. The heart is a muscle. Just know that. It's a muscle. You see, when you look at your hand here like this, if you are gymming every day and then you stop for 2 years, go and measure your hand again, you see that it has gone down. That means when you are stressing the heart to pump so hard for so long, you are gymming the muscles of the right ventricle, which are actually supplying with the higher pressure to give the systolic, that's the higher level. So it's going to the aorta, to the rest of our body to encounter more peripheral resistance and all that. What do you think will happen? The muscle will begin to get thickened, and then the space where the heart is supposed to accommodate blood to pump into the aorta is already reduced. You understand? It's just like a fat woman entering inside a Nissan Micra in Ibadan. Will there be space for other people to sit down? No. But when the woman begins to reduce her weight, what happens? More people can begin to So you will now be able to accommodate others. And that's the similar thing that happens. When you reduce the stress on the heart, the muscle begins to go back to normal. Because it is, look, there's something called use and disuse theory. John Lamarck's theory. Any part of your body you use begins to develop. And any part of your body you don't use begins to wither off. Go and check people that have severe osteoarthritis. When they don't use that leg that's affected, it begins to get shorter. The muscle begins to get smaller. And that is a similar thing that will happen to someone that resolves the issue why it's having the high blood pressure. Once the heart begins to pump normally and give the heart the opportunity to repair itself, it will repair itself. That's it. So yes, it is reversible, but a lot depends on you. Can we get the recording, please? Okay, just Temitope ask for the recording, please. Our coordinators should please take note of that. Temitope, you should be able to get the recording. Thank you so much, Dr. Drugs. I got value this afternoon. Oh, you're welcome. Okafo Ebele. Adedoyin Yunusa says, thank you so much, Dr. Drugs. I appreciate you. Someone wants to be unmuted. Dr. Drugs, thank you for the deep presentation. Thank God. Adeshola Ipaye. We have Temitope Osinowo. Many thanks for this wonderful lecture. I thank God for the gift of knowledge. Dr. Idigo and Dr. Drugs. Somebody says, I am deeply grateful for this opportunity, SARS. Oh, thank you. Oh, Dr. Idigo happens to be my mentor and an uncle. And of course, he is a wonderful, you need to meet this man and see somebody that takes natural pharmaceuticals and see somebody that is about 75 years that can run, plays golf, does everything. And you will see that truly human beings were initially designed to live forever. Yeah, so you can see. Please unmute me. Can somebody unmute me? I don't know. And there's Kunle. Can someone stop using amlodipine? Yes, you can stop using amlodipine, depending on your health practitioner. Sometimes some people are take amlodipine up to a point, it doesn't work anymore for them. They have to even change it to another thing. They may say, okay, you know what? They may add temsatan or some other thing. It depends on the health practitioner. Remember that, you see, these drugs, to show you how wonderful God is, when you take these things, they actually land on receptors that elicit the action that is needed. When you fire them for too long, they lose their potency. And that's why depending on all these chemical drugs is useless in the long run. The patient begins to graduate from one antihypertensive, maybe patient just taking only Modretic. The patient now graduates into Modretic and amlodipine. The patient now graduates to Modretic and telmisartan, now graduates to Modretic and doxazosin, now graduate again to Modretic and one or two other things like that. Of course, Modretic itself is already amiloride hydrochlorothiazide. That's 2, that's 5 already. And once a patient takes 4 different antihypertensive classes, that patient is already having hypertensive resistance, and that's resistant hypertension. And once a patient takes 5 and above, that patient is having what is called refractory hypertension. He should just go and start writing his will. Don't waste time. Just know that if you don't follow lifestyle modification, then you will realize that I'm saying that hypertension is best to be managed and reversed if possible, which is mostly possible, than to be taking drugs 24/7. They will begin to lose their potency over time. You must have to manage your diet, exercise, your weight, and all that. If not, such a patient is going to be in trouble. You must take natural pharmaceuticals. These supplements are very important because they have no side effects. You can stop drinking cardio health and nothing will happen to you, but stop amlodipine and say, I know one of my uncles that just omitted lisinopril 10 milligrams, he has stroke in the night. I'm telling you a life story. But let's not go into that. You see, these things are very, very important. That's why you must have to follow closely with your health practitioner's instructions and apply your common sense. They gave you 3 classes last month. They added 1, 4, added 1, 5, added 1, that 1, 6. And you are still going to open your mouth so that they use shovel and put tablets for you. You are not applying wisdom. You should be able to ask your health practitioner what can be done for this matter. If he doesn't know, search for who knows. Okay, somebody says she's not a medical doctor. Oh, it's okay. Being a mayor, well, no knowledge is wasted. Thank you so much, Dr. W.O. Arilesere. Okay. Sir, thank you for the lecture. I would like to know if a hypertensive patient have to take all the supplements you mentioned. It is not necessary because no 2 people are the same. Everybody is different. Remember that in some cases, they will have to run weight management program first. I have patients that once they start weight management program, their BP goes back to normal. I know a pharmacist that was taking about 3 or 4 antihypertensive. I placed him on weight management program. In 5 days, he was getting 120/80. Till today, he's still getting 120/80. He tapered the drug for himself because he's a doctor of drugs. He knows what drugs are. Until today, he's still not hypertensive. Then he realized, he told me personally that he never knew that his food has been killing him. It was food that was giving him problem. He will eat and his BP will go up. He will take amlodipine, he will take lisinopril, he will take this, take that, go back tomorrow, eat again. The cycle continued until I told him what to do. And today, we are 5 and 6. So it's not a must. Because if the patient is slim already, where are you slimming the patient down to? You have to face other things. So you must have to consult with the expert to direct you on what to do. That is Minator. Then we have, sir, thank you for the lecture. I would like to know if hypertensive patients have, if hypertensive patients have to take, no, different people. I have a sister-in-law who has fatty liver. Please, what can she use to inform a supplement from fatty liver? Just know this. Go to Dr. Drugs on YouTube and type fatty liver disease. You will see a video there. One of the things I said there is the liver is his own doctor. There are no drugs for liver problems. Just know that this is life. You can ask your doctor. If they give you something like ursodeoxycholic acid, it is from bile. It's a supplement. That is it. If you are giving ursodeoxycholic acid, it's from bile. It's a supplement. If you are giving siliberdine or siliberine, it's from milk thistle, a weed. That's what it is. It's supplements. There are no. Once a chemical lands at the liver, it gets to work. That is why when people are poisoned, one of the first places those poisons go to is the liver. Is the major detoxifying organ in the body. So if the liver is a destroyer of chemical drugs, which chemical drug do you want to give it to repair itself? My brother and sister in the Lord, lifestyle diseases, good lifestyle changes or good lifestyle choices, serious dieting, autophagy, and Garcinia Plus, TEM, Arctic Sea, garlic thyme, aloe gel, of course, C9, that one is sure. You must do that. In fact, I do mine as C30 for my patient because I extend it to 30 days in a special way. You understand? Of course, and you can see that all the other comorbidities that are associated with it will also begin to pack their load and go. Once you remove the thing stressing the liver, it goes back to normal. In fact, if you cut your liver into 3, throw 2 away, that one will grow into a full liver again. That's how powerful it is. It's just for us to give the liver the opportunity to go back to normal. Follow the rules and regulations, and you see that you'll be fine. Okay. Celine says, thank you, doctor, for a wonderful lecture. Can someone that the cells have been completely destroyed be restored back to normal if the person starts taking the supplement? What cells? You know, we have cells that grow very slowly, like nerve cells. For instance, when somebody is having neuropathy, for instance, or sciatica, for instance, because the sciatic nerve has been squished or compressed, you see, it takes a while for it to recover. But if somebody is having an injury on the palm here, you see it heals very fast. You understand? So we have to know what cells they are. And then it's often postulated that injuries on the back heal slowly, injuries on the head heal fast. So it depends on the cells. So you have to be specific on the particular cells you're talking about. But definitely, you have somatic stem cells distributed all over your body. That's one thing you should know. Because you have somatic stem cells, okay? These somatic stem cells are the real stem. That people say that they're taking one thing, something, they put under the tongue, and that they say stem cell. All those things are scams, complete scams. Even if they work, that's not their mechanism of action. They may work via things like powerful antioxidants that give the DNA, protect DNA from damage. But telling you that you're swallowing stem cell or put it under your tongue is a lie. And it stands to be corrected. It's a blatant lie because the cells cannot pass through the layer under your tongue, which are made of cells. And if they enter your tummy, the acid in the stomach, pepsinogen will be converted to pepsin with hydrochloric acid and destroy it. You understand? As well as the hydrochloric acid itself. So what you need to do is to give your somatic stem cells the opportunity to heal. That is why if you have a cut, you don't bleed forever. Because the somatic stem cells do what? They go into and begin to form into the cells that were damaged. So even someone is having a stroke and the person resolves it very quickly, like a case we had recently, the patient had a stroke and we try to resolve it very quickly. In about 5 days, the patient was okay. But if you begin to waste time and more cells begin to get suffocated and die, then it takes longer. So you see that those cells that are damaged completely can be replaced. In fact, your cells get replaced regularly. There's a process called apoptosis. It's where the cells die and new ones replace them. It's a normal process in life. In fact, majority of the cells that are in your body were not there 10 years ago. You are new already. The old ones have gone, new ones have come. So yes, it is possible for cells that have been destroyed to recover. But we need to be specific about the cells so that we know the time limit, the time to take. So, although we have some cells that are so slow recovery that we just assume that they never recover, like cells in the brain and all that. So Laudin says, thank you, Dr. Drugs. I appreciate. We are very delighted to have listened to this wonderful lecture. Thank you so much, Lawal Audu. Good evening, doctor. Please, can I have the video because I joined seminar late? Chiamaka Nwosu. Okay, no problem. It's possible. Francis Uchenda, thank you so much, Dr. Drugs. I take to Brandy. How do I manage it for my work? Are you saying I should stop it? Please, Francis Uchenda, stop taking brandy, okay? Because what brandy does is this. One, it is very harsh. So the skin in your throat and your mouth begins to get damaged. Then two, it will stimulate production of what is called bad cholesterol. Remember that even when this bad cholesterol and triglycerides begin to increase, once the cholesterol, the total cholesterol to good cholesterol level goes beyond 3.4 to 1, you're already on your way to having problems. Or when the triglyceride goes beyond 1.5 to 1, type 2 diabetes is already knocking on the door. So you can see why it's important to stop. Apart from that, a lot of issues, because it can actually even damage certain cells that are close to the pancreas and so on and so forth. Yes, we have what they call enterochromaffin cells that these things can also affect. It also cause ulcer and all that. So be careful. Yeah. Please look for natural stuff you can take. Thanks, you, sir. Yeah, that's good. So delighted to listen. Same here. Thank you, Francis Uchenna. Chamaka Nelson. Thank God. Big thanks. Okay. Oh, someone says regrow liver. No, I didn't say you should regrow your liver. I'm just saying that if the liver is cut off to a good extent, it can grow back. It regenerates. In fact, if the kidney is damaged up to 33.3%, it can still regenerate. The liver up to 66.6% can still regenerate. But beyond that, then there's a problem. That's why these are very important organs of the body, and God in His infinite mercy made some of them too, and also give them superpowers, like the guy called Deadpool, who has, if you see that Marvel guy. Okay, so thank you so much, guys.
Yes, I really want to appreciate you. Please, everyone, I've seen you on the chat room appreciating our speaker, and I want to say thank you so much. This is a way to make use of today. Learning. They said knowledge is power. I'm sure we've learned a lot today, and we are so grateful for your time. Thank you for being here. Prevention is better than early detection. It's cheaper, it's safer. So that's what we are preaching. We don't want all this sudden death again. Some deaths can be avoided if we take care of ourselves, if we are intentional about our health. And so we are so grateful for this. Dr. Gross, thank you once again for being here. You are a wonderful partner. We are together in the same team, and we appreciate all that you are doing for the world in the area of health and wellness. So we will come again next time. This is Oyeyemi Olusonya representing the Flourish Partners, and we work together with our amazing Dr. Drugs today. So thank you very much. I think we are still having some questions. People are still, they don't want you to go. Okay, we will look. Please get in touch with the person that invited you. We'll make the video available. Okay, because I know a lot of people are asking. Somebody's okay. So Oladapo Olatunji, I need to get rid of blood pressure. I'm sure you have heard today. You need to be intentional about what you put into your mouth and get in touch with whoever invited you. I'm sure they will help you also. What causes heartache, sir? Dr.
Okay.
Drugs, heartache.
Okay, yes. That's a very, very interesting question. You see, heartache is often caused as a result of poor blood flow to heart cells. These heart cells need oxygen and nutrients. The way they complain is by having what is called heartache or what is called angina pectoris. So once the blood flow is restored and the dying cells begin to receive nourishment, not after they have died though, then you see that the heartache begins to get mitigated. And if the strain on them is too high, maybe the person is the kind of person that is a workaholic and doesn't rest, you can see that such a person needs to begin to rest more, diet, exercise, and allow better blood flow by reducing the amount of cholesterol, blocking the blood flow. The heartache begins to resolve on its own. So that's one thing that can cause heartache, apart from what I mentioned called Takotsubo syndrome, which is a heartbreak syndrome, where we have contraction and sometimes spasms of blood vessels as a result of deep emotional stress, which I mentioned happens mostly to women, especially when they have a heartbreak. And you can see that avoiding such emotional strain can also mitigate that as well. So thank you very much.
Wow, I hope that answers your question. So on this note, we would like to end this. It's been a beautiful time with you, our guests in the house. So on behalf of Flourish Partners and the Power Team, Dr. Drugs, we appreciate our daddy, the leader of this group, Dr. Etiko, for always being there. We cannot thank you enough, sir. I want to appreciate everyone that has joined us today. May we live longer and longer, and may God give us the grace to do the right thing. So thank you very much, everyone. We are very grateful. Okay, I don't know if there's any other question, so we can just call it a day. Oh, somebody said, how do I manage or address left muscle pain on the chest? I think we need to address this. It's very important. Anything that has to do with the chest. I'm always
now if we're talking about left muscle pain, then I'm assuming you are referring to what is called your pectoralis major. That's what is called chest. So that's what I'm looking at. That's the one that they, in Yoruba will say Ige. That's or Igbo say Akpobi and all that. If you gym, then you may have stressed the muscles of your chest so much. And especially if you're having cholesterol blockage as well, then the muscles on the pectoralis major, that's the left muscles, may also begin to experience just such pain. So you have to be sure that you are not over-exerting those muscles. You understand? You know? So
He said he used to go for gym. So I think
exactly.
he said before, I do gym.
Let me see. Good. So you can see that even you can see that without that already, you already know what's happening, because if you look at it very closely, I didn't even know you used to go to the gym, but you can see that you may have caused a little, you may have stressed that area too much. Please watch your lipid profile and also take substances that can begin to help to heal whatever may have been damaged in that area. As far as it's not your heart, because I know that if it were your heart, you would have said that it's your heart. So you have to make sure you take care of those things. Lifestyle modifications are very awesome. And of course, cellular repair, you have somatic stem cells on standby that God put all over your body to repair whatever has been damaged. You understand? So you see that this will help a lot as well. Thank you very much.
Okay, I think on this note, we want to say thank you once again, and we want to appreciate everyone that came. We'll try and make the recorded version available. So get in touch with whoever invited you and make a request if you really want it. So by the time it's out, we'll send it across to you. And please don't take it alone, share with others. Thank you very much and have a wonderful day. Stay safe and God bless Nigeria. Thank you.
Okay, good night. Thank you so much and bye.
Good night, Dr. Drugs. Thank you.
Thank you. You're all appreciated. Bye-bye.
Thank you, Michael. I'm glad you made it.
God bless you. I enjoyed it.
Thank you very much, everybody.
Thank you so much, everybody.
Yeah.
Okay. Bye.
Okay.